Greetings, welcome everyone. I'm Jed Schlackman. I work as a holistic counselor, a hypnotherapist, and also an energy healer. Today's video is one where I'll be speaking about light therapy and specifically green light therapy. This is something that many of you have probably not heard much about so far. However, it's something that can be rather useful and helpful for a number of different health concerns. So first, let's talk about light and color. In the electromagnetic spectrum, we have visible light, the rainbow colors of visible light that most of us are quite familiar with. So you have the red frequencies at the lower end of that spectrum and violet at the upper end of the visible light spectrum. But then beyond that part of the spectrum, you have above violet, ultraviolet frequencies. Those are the ones that we often refer to as UV, short for ultraviolet light. And that spectrum is part of the sunlight. So the sun is providing the visible light, but also the ultraviolet, which is the higher frequencies. And then going below red, you have infrared, sometimes abbreviated as IR, short for infrared. And that part of the spectrum is very important as well. And sunlight certainly provides the infrared light spectrum. And there's a lot of applications for infrared in terms of health. So there's infrared saunas, infrared light therapy. It produces heat, so it's something that is often used for detoxification, for healing from illnesses. So with all of that in mind, that whole spectrum, the visible light color green is right in the middle there, in the middle of the visible light spectrum, and the visible light spectrum is in the middle in between the ultraviolet and infrared. Now, as human beings, we naturally have this filtering mechanism for our vision where we're seeing the visible light spectrum, but we're not physically seeing ultraviolet and infrared frequencies. There are other animals or organisms that can, with their vision, perceive those frequencies of light. So we have a somewhat limited perception. There's a lot going on in terms of frequency and vibration beyond what our physical sight can perceive. We do have other ways of sensing or perceiving things. So if you're in a place where there's a lot of infrared light, you'll feel the heat of it, even though you might not be seeing the actual color of it. With green light, that's a visible light color that we do see, and it's something that's been explored in recent years for its usefulness in terms of healing and pain relief and different therapeutic applications. So I'm going to do a screen share now as we go through an article that talks about green light as a therapeutic resource. So let's switch to that screen now. Here we go to the University of Arizona, their health sciences website. And there's an article there called Shining a Green Light on Pain Relief. People who suffer from migraine and fibromyalgia are reducing their pain and improving their quality of life thanks to green light therapy. According to the Migraine Research Foundation, more than 90% of sufferers are unable to function normally during their migraine, which can be accompanied by visual disturbances, nausea, vomiting, dizziness, extreme sensitivity to sound, light, touch, and smell, and tingling or numbness in the extremities or face. Migraine can also be difficult for physicians to treat. Traditional therapies range from oral medications, which may have side effects, to Botox injections, nerve blocks, or implantable nerve stimulators, each with varying degrees of success. But a new potential treatment that uses green light exposure is offering people who suffer from migraine new hope thanks to researchers at the University of Arizona Health Sciences. Mohab Ibrahim, MD, PhD, medical director at the Comprehensive Center for Pain and Addiction, a strategic initiative of U Arizona Health Sciences, has been studying the effects of green light exposure in rodents for several years. He led a research team that completed the first clinical study to evaluate green light exposure as a potential preventive therapy for patients with migraine. Migraine is one of the most common neurological conditions in the world and is debilitating, said Ibrahim, lead author of the study, professor in the Arizona College of Medicine, Tucson's Department of Anesthesiology, and director of the Chronic Pain Management Clinic. 29 participants, all of whom had failed multiple traditional therapies for migraine, were prescribed green light exposure as part of the study. In this trial, we treated green light as a drug, Ibrahim said. It's not any green light. It has to be the right intensity, the right frequency, the right exposure time, and the right exposure methods. Just like with medications, there is a sweet spot with light. Overall, green light exposure reduced the number of headache days per month by an average of about 60%. The majority of participants in the study reported a more than 50% reduction in headache days per month. Using a numeric pain scale of 0 to 10, participants noted that green light exposure resulted in a 60% reduction in pain from 8 down to 3.2. Green light therapy also shortened the duration of headaches and improved participants' ability to fall and stay asleep, perform chores, exercise, and work. None of the study participants reported any side effects of green light exposure. The overall average benefit was statistically significant. Most of the people are extremely happy, Ibrahim said of the participants, who were given light strips and instructions to follow while completing the study at home. One of the ways we measured participant satisfaction was when we enrolled people, we told them they would have to return the light at the end of the study. But when it came to the end of the study, we offered them the option to keep the light, and 28 out of 29 decided to keep the light. The non-invasive nature of green light exposure makes it an ideal therapeutic candidate for other neurological conditions such as fibromyalgia or HIV-related pain. Searching for the how. Chronic widespread body pain, moderate to extreme fatigue, sleep disturbances. In the late 1800s, patients with those symptoms were diagnosed with muscular rheumatitis or neurasthenia, conditions physicians struggle to treat. Today, those same symptoms, plus cognitive difficulties or brain fog, and sensitivity to touch, light, and sound may result in a diagnosis of fibromyalgia, the treatment of which still challenges doctors today. Fibromyalgia is one of several invisible diseases, chronic conditions with debilitating pain and fatigue symptoms that can't be easily recognized just by looking at someone. It affects an estimated 10 million people in the US, according to the National Fibromyalgia Association, the majority of which are women. We really do not understand the pathophysiology of fibromyalgia, Ibrahim said. There are some theories and hypotheses, and we are getting closer, but we're not there yet. So because we don't really understand why some people develop fibromyalgia and why others don't, we try to manage the symptoms associated with it. From 2016 to 2019, 21 people with fibromyalgia were out of traditional treatment options and completed a pilot clinical study to test the effectiveness of green light therapy. Each study participant was given 2 LED light strips, one white, one green, and instructed how to use the lights. White for 10 weeks, followed by green for 10 weeks. Participants were asked to use the lights in a dark room with no other light source for a minimum of 1 hour every day, with the option to increase 2 hours daily. They were encouraged to stay awake, no sleeping, and engage in activities such as writing, reading, or listening to music that did not require an additional light source. Activities that introduced other light sources, such as watching television or using a smartphone, were discouraged. Each participant filled out surveys throughout the study to document how they were feeling. The results were astounding. Their pain improved, their quality of life improved, said Ibrahim, who was assisted in the research by Laurent Martin, PhD, who started in Ibrahim's laboratory as a postdoctoral researcher and is now an assistant professor of anesthesiology in the College of Medicine, Tucson. Specifically, participants reported an average reduction in average pain intensity from 8.4 down to 4.9 on the 10-point numeric pain scale when using green light compared with white light. Participants also reported improvements in pain frequency, duration of pain episodes, ability to fall asleep and stay asleep, ability to work, exercise, and do household chores, and overall quality of life. Ibrahim also is using a 1.78 million grant from the National Institutes of Health for a preclinical study on the effects of green light exposure on HIV-related neuropathy and the hypersensitivity associated with antiretroviral therapy. Beyond that, Ibrahim wants to figure out how green light therapy works to reduce migraine headaches and pain intensity. Now we know, based on this preliminary study, that green light therapy is good. This is a great finding, but this is where the story begins, Ibrahim said. As a scientist, I'm really interested in how this works, because if I understand the mechanism, then I can utilize it for other conditions. In the meantime, he works with other physicians to treat patients with green light therapy when appropriate. He has received requests for green light therapy consultations from doctors as far away as Europe, Asia, and Africa, as well as at home in Tucson, where he is delighted to have an economical, safe, and potentially beneficial option to offer his own patients. So that's the story from the University of Arizona, exploring green light therapy for pain relief. Green light therapy has also been used for various skin conditions. So that's another potential application for green light therapy. and it's something that's very economical and practical. The article mentioned LED, green light devices. Well, you can also use laser light devices that have green light. So I'll show you a little simple sample of that. Here's a green laser pointer. Now you wouldn't want to point it in your face. You don't want it directly in your eyes, but you can point the green light onto any surface. So if you wanted to point it toward your skin, you could take some green light and direct it there onto the skin. And this is a very inexpensive device. It's just a simple laser pointer. And you could determine the length of exposure, how many minutes, how often to do that. So it's a very practical tool for light therapy. And green light is actually all around us, obviously. It's part of the visible light spectrum. If you go out in nature, in the sunlight in particular, especially surrounded by greenery in the forest, for example, that's increasing the amount of the green part of the spectrum that you're getting exposed to. So just by being outdoors in a natural setting with greenery, you're increasing your green light exposure, and you might notice some of these types of benefits from that. It might help reduce pain, it might help reduce headaches. So it's essentially a free resource to support your health. I hope that this video has given you something to consider or explore that could be helpful for you, that can be beneficial for your physical and mental health. For those who are interested in holistic healing resources and therapies, I invite you to visit my website, phinsights.com, phinsights.com. For now, I wish everyone a wonderful day. Namaste.